Hi everyone, I'm Tammy and I'm the Staff Development Manager for Home Health and Hospice. Today we're going to be going over how to de-access and access your patient support. But before we get into the steps, I want to make sure that you know the equipment that you're going to need to bring to your patient's home and to have all of your supplies ready. So on this barrier drape here, you see that I have all of my supplies ready and laid out so that I can quickly access them while I'm with my patient. You're going to want to grab a bio patch, a couple of alcohol prep pads, 2 to 3 saline flushes, a heparin flush, gloves, your hand sanitizer, a clave, and lastly, your Hubert needle. Really quickly about the Hubert needle, you want to make sure that you know what size needle your patient needs. Some patients may need a 0.75 inch, some patients need an inch needle. It depends on the patient's depth. If their port is a lot deeper, they're gonna need a longer needle to really access that area and for you to get blood return. In addition to all of these equipments, you're also gonna wanna make sure that you grab a central line dressing tray because in here has your mask, your sterile gloves, your Tegaderm, and everything that you're gonna need to clean the site and perform the dressing change. So let's begin. So before we even de-access our patient's port, we want to first hand hygiene and open up the dressing change kit so that we can grab the mask that's inside. If your patient does not want to be masked, you just want to make sure that you ask them to turn their head away from the area that you're going to be inserting the needle at. You're also going to want to make sure that you are wearing a mask. So once we open up the patient's central line dressing kit, there is a mask readily available for you to wear. I'm going to go ahead and put this on. And because I have touched my face to put on the mask, I'm going to hand hygiene again and put on regular gloves so that I can go ahead and de-access my patient's port before I access their site with the new needle and do their dressing change. So let's go ahead and de-access our patient's port. It's important for you to know whether or not you're going to be accessing your patient's site again with the new needle, or you're just going to be de-accessing the Hubert needle and HEP locking the site. If you're going to be HEP locking the site, you're just going to want to de-access the patient's needle. But before you do that, you're going to want to clean the patient's clave with alcohol wipes for 20 seconds, connect a saline flush, and then HEP lock the site. After you've done that, you can go ahead and remove the patient's needle. So if you're going to be de-accessing your patient's port and placing in a brand new needle, you're going to want to make sure that you grab an alcohol prep pad to clean the clave for at least 20 seconds. Grab a 10 cc NS syringe. And you are going to then flush the patient's line. So I'm going to unclamp the line and I want to flush the patient's line with NS. As I'm doing that, I also want to pull back and make sure that I'm seeing some type of blood return into the tubing. And the reason why this is really important is because when you're accessing the patient's port again, you want to go back into that same area that this needle was at. And you want to make sure that you have really good blood return. So we see really good blood return. We're going to go ahead and flush the rest of the 10 cc's. We are not going to HEP lock the site because we're going to go ahead and change out the needle, flush the line, and at the very end, we're going to HEP lock it. So now we're ready to go ahead and remove the Hubert needle. So the process of you actually removing the Hubert needle is not a sterile process. So you're going to want to grab alcohol wipes and go ahead and remove the Tegaderm from your patient. So once you're done removing the patient's Tegaderm, you're going to go ahead and de-access the patient's needle. Now it's important for you to make sure that you have a gauze so that you can cover the site in case the patient starts bleeding. And we're going to go ahead and let our patient know that we're going to de-access their port. Now de-accessing the port is very, very simple. All you need to do is you hold down the patient's Hubert needle on one hand and you lift the other straight up. You're going to tell your patient on a count of 1, 2, 3, they're going to go ahead and take a deep breath. And as they're doing that, you're going to pull the needle straight up. So we're going to tell our patient, Mr. Smith, go ahead and take a deep breath. On 1, 2, and 3, we're going to pull the needle straight up. And as you can see, as you pull the needle straight up, it locks as a safety mechanism this way, and this needle is secure. We're going to go ahead and remove the dressing. The patient then can hold onto the sterile gauze if there's any bleeding to the site, and we're ready to clean the site and place a new needle in. So now we're gonna go ahead and prepare all of our supplies before we lay out our sterile drape. So on the right-hand side here, you see that I have my bio patch ready. I've removed the top so I can easily pour it onto my sterile field in just a little bit. And then the next thing I wanna prep is my clave and the Hubert needle. So I like to make sure that I keep my clave inside the original packet, and I'll go ahead and prime the clave with my saline. So go ahead and prime your saline and connect it to your clave and leave it inside the packet. The next thing I'm gonna wanna prep is the patient's Hubert needle. It's very, very important that you do not touch the actual needle because you want this to be sterile. Instead, what you want to connect the clave to is the patient's end connection here. So we can go ahead and just connect the patient's clave to their end connection and leave it out until we are ready to connect it to our patient. So at this time, I'm gonna go ahead and flush and make sure that I prime the line, and I'll leave it here to the side. We're gonna go ahead and remove all of our gloves and make sure that we have everything ready so that we can set up our sterile field. Once we're ready to set up the patient's sterile field, I'm going to hand sanitize, and I am going to lay out my sterile drape. So I'm gonna go ahead and open up my dressing change kit, and I'm going to grab the corners of my sterile drape and place it next to my supplies, okay? After I'm done doing that, I'm gonna drop all of the supplies that I need onto my sterile field that needs to be sterile. So one of that is my patient's bio patch. So I wanna make sure that I go ahead and open up the bio patch and that I drop it into the sterile field so that when I need it and I'm ready to access my patient's port, it's readily available for me. The other thing that I want to grab is the patient's Hubert needle. So it's really important that you don't touch the patient's needle. So I'm just going to go ahead and let this sit at the corner of the patient's sterile drape. The reason why I put this at the corner is because the patient's syringe is technically not sterile. We've touched this, and so you just want this to sit out, and the part that's most important that needs to be sterile is sitting inside the actual sterile field. So we've pretty much set up everything and we're ready to put on our sterile gloves. I'm gonna go ahead and hand hygiene and put on the sterile gloves before we access the patient's port and clean their site. Now I have already hand hygiened and I'm gonna be putting on the sterile gloves. So I'm gonna go ahead and grab the sterile gloves and place them on. Okay, so now we're ready to clean the patient's site and access their port. So once you touch the patient, remember, you're gonna no longer be sterile. So I'm gonna go ahead and grab the ChloraPrep. To access the ChloraPrep, you're just gonna go ahead and push on the sides, and we're gonna clean the patient's site really nice and vigorously by scrubbing the area. So you wanna clean the port, make sure that you're scrubbing back and forth. It's the friction that really matters here, so we're gonna make sure we keep scrubbing. And once we clean outwards, we are going to go ahead and toss the ChloraPrep, okay? Okay, so we're gonna toss the ChloraPrep, and now we're ready to insert the actual Hubert needle. So now we're done cleaning our patient and we're ready to access their port. The next thing you're gonna wanna do is make sure that your needle and your bio patch is ready to go. Remember, once I've touched my patient, my hand is no longer gonna be sterile. So I wanna make sure that my Hubert needle and my bio patch is together. It really depends on you. I find it a lot easier for me to pull off the plastic cover and to grab my bio patch and put it right underneath so that when I access my patient's port, it's already there and I don't have to slip on the bio patch after the needle is accessed. So I'm gonna go ahead and move over to my patient, and I'm gonna touch and feel the port so that I know exactly where I'm going. So here, I know exactly where my patient's port is at. I'm gonna hold the skin nice and taut. I'm gonna go in at a 90-degree angle. It's really important for you not to hesitate at this moment, because the more you hesitate, the more the patient is gonna feel you actually inserting the needle. I'm gonna tell my patient to take a deep breath, 1, 2, 3, and I'm gonna go right into the middle. At this point, the bio patch is already sitting on top of the patient's skin. You're gonna go ahead and hold it down, and you're going to pull back for blood return. And once you see blood, you're gonna go ahead and flush with 10 cc's of NS. You can go ahead and lock the site and disconnect your patient from the saline. You would then grab your heparin and connect the heparin to the patient. You can then go ahead and put the patient's skin prep and Tegaderm on top. At this point, you are all done. All you need to do is flush your patient's line, hep lock it, close the clamp, put your date, initials, and the time that you change your patient's dressing, and you're all set. You can then remove your gloves, hand sanitize, and clean up your workstation.